Hi, I'm AJ Fisher, and I'm a graduate of American Public University with a bachelor's and a master's in sports and health sciences. I'm extremely excited to be spearheading this research. Now, this is our second study, our first grant from American Public University. Thank you so much. We were able to show some really interesting points, and now that served as our foundation for this second study, and we hope to continue the research for many years to come. I'm so thrilled to be working with an exceptional research team, Dr. Herrenbrook of American Public University, Adrian Reed of Columbia University, and Dr. Alex Rothstein, who's the head of the Exercise Physiology Lab at NYIT, New York Institute of Technology, where we've been performing a lot of our research using the Physiology Lab at NYIT. Now let's take a look at what we've been working on, our second study together as a research team, what we found in our pilot study, and also what we'd like to accomplish together in the future. Coming out of our pilot study where we asked the question, can intermittent hypoxic breathing lower SpO2 levels that are seen in traditional altitude training, traditional hypoxic training, and can we see improvements in areas such as body composition, strength gain, resting metabolic rate, waist circumference, and SpO2 mimicking those levels that are seen in altitude and hypoxic training. And we did indeed find a positive relationship between the intermittent hypoxic breathing and improving most of these areas. So it was an incredible foundation in the pilot study, and now moving into our second study that sits on the shoulders of that pilot study, now we're asking the question, can intermittent hypoxic breathing and also traditional hypoxic training affect the lactate levels in the exercisers? And now we are asking the question, what is the impact of intermittent hypoxic breathing on lactate and SpO2? Intermittent hypoxic training has been shown to be highly effective in enhancing exercise results, including body composition, strength gain, and heart rate variability. High lactate exercise training or lactate threshold training has been shown to be a highly effective method of enhancing results from exercise, including body composition, performance, and cognition. And so now we have these two modalities of exercise, intermittent hypoxic training and lactate threshold training, that both have shown similar benefits, including cognition, which is an area that we'll certainly get into. The use of intermittent hypoxic breathing has the ability to lower blood SpO2 to levels consistent with traditional intermittent hypoxic training. And now we have seen this in the pilot study, and we're really excited about the second study because we are going to have more advanced technology that is going to show us the continuous blood oxygen using a more advanced pulse oximeter, giving us more detailed and continuous graphs to represent the SpO2 levels for the entire exercise session, including work and recovery. The use of intermittent hypoxic breathing with an emphasis on hypoventilation, that's slow breathing, slower than normal breathing, also has the ability to increase lactate levels. Therefore, does a combination of intermittent hypoxic breathing and movement have the potential to lower SpO2 and increase lactate to levels known to be beneficial as seen in IHT, intermittent hypoxic training, and lactate threshold high intensity interval training? Extremely excited to explore this question to see if we can observe lactate levels that rise to a point that potentially could benefit the mind and the body during exercise by using this hypoventilation, this intermittent hypoxic breathing technique that not only is lowering blood oxygen levels, but is also increasing lactate that could be used by individuals who can't necessarily perform traditional high-intensity exercise with the higher impact or the high resistance, whatever it may be. It could be someone who's injured, someone with a disease, the elderly, who might want to use a technique, a novel technique, that increases the lactate in the body to levels that could be beneficial for cognition and also for the body. And once again, our research question, does intermittent hypoxic breathing with exercise increase lactate levels and decrease SpO2, blood oxygen, to levels known to be beneficial as seen in traditional intermittent hypoxic training and lactate threshold or high intensity interval training? We're going to use hypoventilation with a very specific tempo, frequency, intensity, and duration of breath. This is extremely specific. It uses a metronome at 60 beats per minute so that we have a strong constant for the breathing method, where we perform 8-second exhalations and a certain amount of breath retentions at the conclusion of the exhalation. And we're performing this in conjunction with low intensity body weight movement. And this is to help support the exploration as to whether or not we can use slow breathing that also brings the blood oxygen down to increase lactate levels during exercise with low impact, low intensity movement that could be performed by an individual who may be restricted in terms of not being able to perform traditional high impact and higher intensity exercise. There are a multitude of benefits to hypoxic training, hypoxic exposure. Altitude training has been performed since the Mexico City Olympics in 1968. There's been decades of research on hypoxic training, hypoxic exposure, which is hypoxic training ultimately at rest, on the brain, spinal cord injury, metabolism, blood glucose, improved blood pressure, body composition, increased fat loss during and after exercise, increased strength, increased muscle mass. It's incredibly exciting. Now, the caveat is that traditional hypoxic training, or even terrestrial hypoxic training, which is altitude training, requires the exerciser to climb a mountain, which is incredibly time-consuming and costly, or buying hypoxic equipment, which is also on the expensive side. And if you aren't a professional athlete or a trainer or in the exercise educational sphere, it may be difficult to justify spending the amount of money or the amount of time on the costly hypoxic equipment or traveling to altitude to experience these gains from exercising at altitude or in hypoxia. Therefore, because of the cost, because of the time, because of the effort, it would be nice if there were an alternative. And this is what initiated the pilot study 3 years ago, which asked the question, can a very specific intermittent hypoxic breathing technique that uses a metronome, the tempo, the frequency, the intensity, and the duration is incredibly specific to use as a constant, can that breathing method mimic the blood oxygen levels, the positive blood oxygen levels, the lowering of blood oxygen, the SpO2, to levels that are seen in traditional, safe altitude training and hypoxic training? And what we did find in that pilot study is we were able to confirm that. And so that's incredibly exciting. And this has allowed us to now move on to our next question in the second study. So with a voluntary breath hold technique, we have a high availability because all you need is your breath, your lungs, your healthy body. It doesn't cost a thing. Doesn't cost anything. You just need to learn a technique, a safe technique. And so therefore there is a bit of effort in learning the technique. It's an incredibly simple technique and can be learned by watching a video online. So it's incredibly accessible to all, and we're really excited to move forward researching both hypoxic training and this voluntary hypoventilation breath hold technique to further the research in this area. The benefits of lactate training, and here's where it gets exciting. Hypoxic training and even slow breath training has been shown to increase lactate. Now we know that there's years of research looking at lactate and increased levels of lactate from high intensity exercise, and now looking at the positive effects of lactate on the body and the brain. In terms of the body, increased VO2 max, improved performance, decreased recovery time, improved bone density, absolutely incredible. And when it comes to the brain, improved connectivity, decreased cognitive decline, improved stress response, decreased depression, multitude of studies looking at lactate and depression, lactate and Alzheimer's, dementia. It's incredibly exciting. And so we're thrilled to be exploring this hypothesis that a combination of slow breathing and breath retentions with low intensity movement could not only lower the SpO2 levels, but also increase lactate levels for a person to experience these benefits. And just to reemphasize, our overall goal is to provide a free, accessible, and low-impact technique that provides the hypoxic and lactate benefits of IHT, intermittent hypoxic training, and lactate threshold training without strain on the body and costly equipment necessary to perform the traditional techniques. And now here's where it gets really exciting. Future directions. There are so many future directions that we can go, and every study builds upon the last. It's incredibly exciting. This is a really novel area that we're looking into, but could have a profound impact if we continue to increase our population number and improve our technologies. I would say that when looking at the near future, in terms of the next couple of years of research, our research team is incredibly interested in a local hypoxic facility under the direction of me in New York so that I can oversee the research in a hypoxic chamber and also a facility where we can turn the altitude off and also perform the breath training with local subjects. Not only would this be wonderful to have a local hypoxic private facility that's only devoted to this research, and so ultimately it's an APU, American Public University, research devoted facility, but also the N number, the population, can be increased because it's being overseen by me and my access to the population in the New York area. And so that would just be wonderful to start there, because from there, with bigger population numbers and me being directly in contact with the subjects and with the research and having a body composition machine, now we only are going through one IRB through APU, and we have our equipment, our testing equipment, and our altitude technologies available to us at hand, and performing copious amounts of research, which would just be a wonderful dream. So having the hypoxic facility and also increasing our participant population with the private facility can really increase the strength of our research, leading to potentially a bigger publication in a bigger journal, which of course would strengthen our research and would be great for us as a research team and also for American Public University. Also, because of the technological issues that we've run into with NYIT, and New York Institute of Technology is in New York, but it's in Long Island, and so even me living in New York, I haven't been on site, and so we've been doing everything remotely. And while it's been wonderful and while we've communicated at the highest level, some problems could have been resolved faster if the research was being performed locally and I was on site. And so that would just be a wonderful short-ish, long, medium-term goal. Now, in terms of what other questions do we want to ask? Well, does this breathing technique lessen pain in the body? Does it lessen back pain in the body in contrast to involuntary breathing or normoxic and a hypoxic environment? Does intermittent hypoxic breathing increase muscle mass locally when compared to hypoxic and normoxic training? Does intermittent hypoxic breathing improve blood glucose levels in a diabetic or pre-diabetic population when compared to hypoxic and normoxic? We do know that hypoxic training has been shown many times to improve resting blood glucose, and it would be an interesting study to look at comparing slow breathing with the hypoxic environment. Does intermittent hypoxic breathing improve blood pressure? There's an area that's been studied for decades in terms of hypobaric chambers and sea-level hypoxic chambers, looking at improvements in hypertensive patients for months at a time after going through a 2 or 3 month hypoxic protocol. In fact, this has been studied in Russia for many, many decades, starting in the 1930s, where they would bring hypertensive patients into the barometric chambers, hypobaric chambers, and they would perform 2-3 months of hypobaric training, and their blood pressure would be at healthy levels for several months after the treatment. And so, and certainly anecdotally, on a case study level, as a personal trainer, many of my clients have changed their gyms to hypoxic environments. And I have one client in particular, he's 78 years old, and he has improved his blood pressure, and he previously was on blood pressure medication, and now with the hypoxic training, he has seen that his blood pressure indeed is now maintained at a healthy level. And so, of course, that's just a, an N=1, but that would be an extremely interesting area to research, and having a local hypoxic facility in conjunction with testing the breath training would just be extremely fascinating and potentially very useful for hypertensive population. Does intermittent hypoxic breathing improve heart rate variability when compared to hypoxic and normoxic training? That would be an interesting area. Does intermittent hypoxic breathing lead to increases in EPO in the body, erythropoietin, which is the hormone that creates more red blood cells in the bone marrow? And of course, that is the hormone also that can be made synthetically, and professional triathletes and cyclists had been taking for many, many years, increasing the VO2 max and increasing the oxygen carrying capacity of the body. And so now we know that we can also increase that with sea level hypoxic training and also traditional altitude training, not to the degree of taking it as a drug, of course, but when you do increase this, you do get that enhanced performance, those increases in hemoglobin and the ability to transport oxygen, and also the increases in red blood cells. And so it would be fascinating to take a look at that as a future study. So you see, the world is vast. I'm extremely passionate about this area, and so I'm thrilled. I know the whole research team is thrilled to continue working on this and to continue making every study stronger than the last one and continuing to answer new questions. So the future is bright, and I'm looking forward to continuing research with APU, and thank you so much for your support.